Sounds funny, but I just can't stand the pain. Girl, I'm leaving you tomorrow. Seems to me, girl, you know I've done all I can. You see a big store and a borrow. Yeah. Why I'm easy? I'm easy like Sunday morning. Yeah, yeah. That's why I'm easy. I'm easy like Sunday morning. I wanna be high, so high. I wanna be free to know the things I do alright. I wanna be free, just me, oh baby. You are the love of my life. I knew it right from the start. The moment I looked at you, you found a place in my heart.
You are the love of my life. You give me reason to live. You taught me how to be strong. With you is where I belong.
Terima kasih atas waktu yang dan kesempatan. Pada hari ini kita akan mengadakan Aquamit dan Kecantikan workshop dan training, hands-on training yang akan dibawakan oleh Dr. Ahli dan presentasi mengenai Aquamit dengan Mr. Richard Bock. Mungkin saya akan perkenalkan diri dulu. Saya dari Ahli Indonesia. Nama saya Iwan Gunawan. Di sini kami bersama dengan Ahli Malaysia, Mr. Ken dari Malaysia, dan Mr. Richard Bock dari Thailand. Dengan adanya workshop ini, kita mendapatkan manfaat yang untuk di kemudian harinya. Dan kita akan sebentar lagi akan mempresentasikan mengenai filler Aquamit oleh Richard Bock, Mr. Richard Bock. Dan apabila ada pertanyaan bisa langsung ditanyakan. Ya, setelah itu kita akan langsung mengadakan hands-on di dengan Dr. Ahli.
So I'll take you through a presentation. If you have any questions, please stop me at any time. Back to injecting Aquamid for multiple sections again, and this is another place where it's in Hong Kong. And again, apologies, this is a little bit blurred, but this woman's nose almost kind of had a U shape right in the middle of the nose. A cc of Aquamid was injected to the mid to upper nose to eliminate that. You can see she has the start of a pretty deep nasolabial fold, and she's very young. So almost a cc of Aquamid was injected in the nasolabial fold area to correct that. And then she had a dimple in her chin, and her chin was not prominent. Expanding indications, starting with Aquamid, we always kind of recommend when you first start with Aquamid, cheeks and nasolabial fold. The reason is if you've never really injected Aquamid, if you make a small mistake in the cheeks and the nasolabial fold, you can massage that. The nose and the chin are a little bit more challenging for a first injection. If you've been injecting a lot in the subcutaneous layer, it's great. You're ready to go. But starting on the nasolabial fold, starting on the cheeks, it's a great way to start using Aquamid for the first time in your practice. You have a little bit of room there to play around with the Aquamid to spread it out. If there happens to be a slight overcorrection, you can massage it away. Big thing that is happening now, particularly in the US and Europe, is what's called needle fatigue, and that's what I was touching on. If a patient's using a hyaluronic acid that lasts 6 or 8 months, their look is changing all the time. They're coming back constantly for injections. They get tired of that and they stop coming. So patients call it needle fatigue. Aquamid helps eliminate that. That's one area where during a consultation with a patient, if the patient ever says, I'm tired of repeat injections, that's a dead clue the patient is looking for a longer lasting filler. So I've already kind of touched on all of this. A big area that for you to be able to promote is the non-surgical nose augmentation. Nose augmentation continues to be a very, very popular procedure all through Southern Asia. Using Aquamid allows you to promote that. What we're here to do, as Alpha Health, we can come in, we can help any kind of training that you want for you or your staff. It's great for anybody doing consultations to understand what Aquamid can and can't do. We're happy to provide you with all marketing materials, happy to provide you with any advice, even if you're looking at a patient and wondering if Aquamid is a good solution. We're happy to help you with that. So, any questions at all? Soft, and we'll say stay soft. I can pass this around and everybody can just have a feel, but it's very, very soft. So when this is injected and it integrates in the tissue, it will stay this soft. So I'm happy to pass this around and let everybody. Anybody want to? If you want, you can work it and see how it will come out, everything. So you see there's no microparticle, there's nothing in this that's going to cause any kind of granuloma or tissue hardening. It's very, very soft. It will feel very, very natural once it's been injected. You can form with your fingers as well. If you're injecting, you can touch it. You can shape it while you're injecting. It's good to use an antibacterial right after the injection itself. How's that? Massage. Okay, the Aquamid will start to integrate usually in about 2 to 3 days. The moment you inject it, it will stay where you injected it. After 2 to 3 days, it will start to integrate. If it's going to be a hard massage, you might want to tell somebody to wait even like 2 months.
Ya,
Kalau tanda dia naruh di dalam masa
dokter inject more superficial dan become redness.
There shouldn't be redness. What will happen is actually the Aquamid can move. Then, if it's very superficial, the Aquamid won't be able to integrate with tissue. So that's where you can see the Aquamid move if it's very superficial. Can you inject again or take it out? Okay, so taking it out, the best way is you never have to take it out. If you have a bit of an imbalance, and this happens a lot on the nasolabial folds. So you inject one fold, then you inject the other, and you think maybe there's too much in this side. All you would do is go back to the injection channel and start squeezing, and then you will see the Aquamid is very thick. It will start to pop out. You can just pull. If the Aquamid has been in the body for 2 or 3 months, you're not going to be able to move. That's where if you wanted to get it out, you would actually need to go inside, make a small incision, and suction it out. Really what you want to do is you want to make sure the patient wants the Aquamid. If they want the Aquamid, you should never have to take it out. If you overcorrect a little bit, you can squeeze it right out right away. So for massage, it's just fine to do some massaging for you, the doctor of the Aquamid, particularly on the nasolabial fold. So it's fine after you inject to massage it and smooth it out to make sure that it's covering the whole area. That's just fine.
Late immune reaction after 3 or 4 years after
No cases at all. It's been around for 11 years with no, since it's 97.5% water, and our bodies are very used to polyacrylamide, so there's really no reaction short or long term. No. That's the best thing you can do is with a patient selection, is to offer them options. If somebody says, I'm not sure how I want my nose, I would not use Aquamid. You could use a hyaluronic acid, inject it, and take a picture of them and say, do you like this nose? That hyaluronic acid will probably be gone in 4 or 5 months. Then you could use Aquamid. What nobody wants to do is there's not a product that makes Aquamid go away. You can excise it. You can actually take the needle and pop it and pull it out, but you don't want to have to do that. If the patient is not sure what they want, hyaluronic acid is a better solution.
Ada ini ya, misalnya kepala sinar matahari ternyata diganggu gitu. Ada efek sampingnya nggak dok kalau kemarin nggak boleh terpapar, dan kalau kita sering terpapar matahari, apakah kita harus di ruangan ber-AC gitu?
Setelah injek.
Iya.
So the question after inject Aquamid, is it avoid to
UV.
sunlight?
There should not be any problem with the UV, no. Of course, you want to tell anybody to avoid all the UV they can avoid every day, but no problem. No granuloma, no. I'm sorry, what was it? No. Because there's nothing in Aquamid that causes a reaction. The granulomas are caused by what the body encapsulates. So with radius and with Sculptra, there were at times a lot of problems with granuloma. So that's a microparticle that's irritating to generate collagen. As that is biostimulating and irritating, the body will surround it and cause a granuloma. There's actually never been a case of granuloma without an infection with Aquamid.
Dokter ada model ya?
Model 1.
Untuk ujung. Jadi mungkin bisa lihat di dalam